Trumpcare, ACHA, however you know the name of this bill, it doesn't matter. It passed through the House. 0 hearings. No one knows anything about it but 10 Republicans, Mitch McConnell and his 9, boys. Those are the only human beings on the planet that know what this insane healthcare bill is going to be, right? The very little that we do know is just going to rip apart healthcare as we know it in this country. It's going to rip it to shreds. This video, I am going to talk to you nurses and explain to you why the ACHA, why Trumpcare matters to you and what this means for us moving forward. But I want to talk to you, of course, we're going to talk about what it means to us as nurses. But more importantly than that, this is going to rip apart the country. I am going to talk to you about what this means to you first as an American citizen, because this is going to affect you, it's going to affect me, it's going to affect every nurse in the country, every person in the country, rich, old, poor, young, disabled, healthy, everyone will be affected. I'm going to go down the little that we do know, the big provisions that this bill is going to pass, if the bill passes, the big provisions that the bill is going to have in place, and how that's going to affect us here in the States. All right, so starting out with Medicaid, the bill would cut $880 billion over 10 years from Medicaid, the program that provides health care to about 74 million poor, disabled, and elderly Americans. That's 1/4 of its budget. As a result, 14 million fewer people would have access to health care by 2026, according to a CBO analysis of the earlier bill which contained similar Medicaid provisions. The cuts would also hurt special education programs, which receive about $4 billion from Medicaid every single year. I thought this for the longest time, that Medicaid was specifically and only for the elderly, but no, it's far from that. Medicaid helps the poor, the disabled, as you just saw, and then the last line that I just read, it helps and has been $4 billion worth. $4 billion worth of special education programs. So this is huge. Like I said, it's going to affect all of us. This is humongous. And that's just the first. That's just the first provision I just read to you, right? Almost $1 trillion off of Medicaid. It's insane. It's insane. Moving on, it would provide $300 billion less over 10 years to help people who do not get insurance through employers and have to buy their own policies. This would hurt low-income and older people the hardest. Again, on top of the fact that older people and very poor people lose Medicaid, this hurts them on top of that. Understand what's going on here. For example, if you're a 60-year-old living in Phoenix, 60, you're not old enough to be in Medicaid, and you're not making that much money. Understand, if you're 60-year-old living in Phoenix and earning $40,000 a year, you would have to pay an additional $12,370 a year to buy a policy. According to the Kaiser Family Foundation, many people who find themselves in this situation would have no choice but to forego insurance. No insurance. So you're going to have to be the healthiest you ever will be between the ages of 60 50, whenever you decide to stop going to your job where you receive healthcare, and 64 when you can get Medicaid, you're going to have to be the healthiest you've ever been in those 4 years. Try not to go to the dentist. Trying to get dentures is a fortune. Try not to go. Anything you do between those years, if you are in that situation, you will not have health insurance. And if you do have health insurance, it's going to be over a quarter. An entire quarter of your paycheck is going to be going to health insurance. And by not great health insurance by any mean stretch of the imagination. This is insanity. This is just insanity. It's unreal that this is happening. Everyone hated the fact that Obamacare made you get insurance, right? People wanted choices, so here are your choices. Many people hate that the ACA, Obamacare, requires people to buy health insurance or pay a penalty, but without that mandate, fewer, younger, and healthier people would buy coverage. Yay, that's me. I don't need coverage. I'm young, I'm healthy, right? Knock on wood, I'm young and healthy for now. I don't need insurance. I'm excited. What does that mean? Let's find out, right? This would lead to what health experts call a death spiral. No foreshadowing, no guessing games, a death spiral. Let's understand what a death spiral is. As insurers raise rates because they left covering people who are older and sicker, leading to even more people dropping coverage, eventually companies could stop selling policies directly to individuals in much of the country. So that is exciting, right? That's just great. Here are the options everybody was hoping for. If I don't need insurance, why should I get it? Right? That was the big question with Obamacare. Why are you penalizing me for something I don't need? It's freaking health insurance. In most states, you're required to get car insurance. In most states, you're required to get insurance on your home. It's health insurance. Forget your car, forget your home. This is this is who you are, your freaking body, the reason you are here, right? If you are not required to get health insurance, all those young, healthy people who don't think they need it, right, will choose not to get health insurance. And all that would leave is these health insurance companies to care for the disabled, the sick, and the elderly. All those people who actually need it, and they have to buy into it, because if they don't, they just won't be able to afford living, right? They won't be able to afford to be alive. But at this point, it seems like no one will be able to ever afford to just live, to breathe. So the health insurance companies are only insuring people who have all those sicknesses, illnesses, disabilities, right? So their rates, the premiums, everything is going to go skyrocket. And by the time you young, healthy folks out there choose that I want to, let me get some health insurance because, I'm getting to that age, 55, 56, where I need things done to me. Or you get into an accident, God forbid, something happens to you where you actually get sick and you need health insurance. But at that point, you already have a pre-existing condition, right? Number one. Number two, everything is skyrocketed because they know the only reason you're coming to them is because you need them, because they know that all those people who don't need the health insurance isn't getting it. So it makes it impossible for anyone. Those people who have health insurance in that situation are going to be paying insane amounts of money. People who don't have health insurance, God forbid anything happens to them, if they were to get sick, go to hospital, whatever, their bills, whatever happens to them, is going to cost them an arm and a leg. Maybe they just won't do it and say, let me go, let's go, I'm done, right? Moving on. I'm sorry, I'm ranting over each and every one of these things because each and every one of these things alone would be just disastrous. This is all of this is in the same bill, all of it. Remember that. The chief executive of Blue Shield of California said the bill could return us to a time when people who were born with a birth defect or who became sick could not purchase or afford insurance. That is what we're going back to. We are going back to the days if you were born with type 1 diabetes, you already are paying a premium. We are going back to the days if you were born with a heart defect, if you were born with any disease in the face of the earth, a health insurance company can say, nope, you have a pre-existing condition, you are going to cost us more money, so we are going to charge you more money. This is health insurance, you guys. This is freaking health insurance. It's health insurance. My God. Republicans say that they will require that states with waivers offer high-risk pools and find other ways to help treat these people. The bill offers $138 billion over 10 years to help states pay for such programs. Experts say this is far too little. Larry Levitt of the Kaiser Foundation estimates it would take at least $25 billion a year. So, yeah, okay. All right, we are going to just tell the states that they require to find something to help with these issue of people not having, people with pre-existing conditions. That's the answer. It literally says here, waivers offer high-risk pools and find other ways to help treat these people. Other ways, no specifics. Find other ways. Good luck. State's choice. You have $138 billion after me taking $300 billion away from those people who needed to get insurance and $880 billion away from Medicaid. After me taking all of that money away, let me give you back 138. Good luck. Figure it out. Bullshit. The bill would also let states waive a requirement under Obamacare that ensures cover a list of essential services. This means people in some places might not have access to maternity care or cancer treatment. This is just I mean, I know we don't have maternity leave from work. I mean, that's the future I was looking for. I was looking to have the fight over, can we please get and live into a country where women who have kids, and hopefully even maybe, but let's focus on the mom who's having a child. Let's focus on them first. I was willing and I was hoping to fight for a future where the argument would be, let's make sure these parents, these mothers are paid when they leave work to have their child. Nope, we're not there. We're not even there. We've gone back. We've gone back to the point where if you are pregnant, if you are a mother, not only will we not cover you or pay, give you your paycheck once you leave work to have a child to populate the country that you served and lived and learned and love. Nope, that's not the argument. We're arguing if you can even get health insurance while you are having that kid. That's where we're at. Like just as a regular person, this is mind blowing. But as a nurse, knowing how much every single thing costs in a hospital, in healthcare, knowing how much every single thing costs, a pregnant mother that is about to have a child, we are not going to cover that insurance based on the state you live in. They have the choice to not cover that as one of their, as part of the policy. And you are left on your own to figure out how, number one, you are going to have this kid without any paycheck because there is no maternity leave. And on top of that, how you are going to pay for the bills that you are as a mother, you are required to go to the doctor X amount of times. If you are having the most healthy birth in the history of the world, you are required to go to the hospital and get checked up, to get chest tested for gestational diabetes, to make sure that you know that the kid's heart is beating okay. Everything, all of these checkups that are required for all moms, that will not be covered. It just will not be. It's the state's choice. On that same note, it defunds Planned Parenthood. Republicans have included a provision that takes federal money away from the organization, which provides birth control, cancer screenings, and other health services to 2.5 million people, mainly women. About 60% of people who use Planned Parenthood depend on government programs like Medicaid. And when you just sit down for a minute and understand, the people who are going to be affected by this the most, it's not just one provision that is going after them. It's not two provisions that are going after them. It's not three. It's every single provision here is going after those who have the absolute worst out of all of us. The very poor, the very old, the sick, and the disabled. And we are talking about health insurance. The topic, the question, the bill, the legislation, it's health insurance. And the people we are going after the most are the people who have the least, like nothing. It's the worst. It hurts. It hurts having this conversation. I can't imagine. And then lastly, so just to close it out, you heard me talk a million times about all this money that the Republicans are taking away. Oh my goodness, Q, didn't you just think for 1 second that all this money is money that we get to keep, right? So that we get to actually have more money in our pockets to buy insurance. No. That's not what's happening. They aren't bragging, the Republicans. They aren't bragging that the bill would reduce tax revenue by $880 billion over the next 10 years. According to the CBO, a vast majority of those tax cuts would go to the most wealthy Americans in this country. So unless you are a millionaire, someone who is already all set with healthcare, someone who it doesn't matter really because you want your own private insurance and you're going to get the best of the best and you're going to go to your own private doctor down the street. If you aren't already that American that isn't even worried about this bill because it wouldn't affect your day-to-day as much, it still will affect you because the actual hospitals and wherever you go will be, I haven't even gotten to that, but those hospitals, wherever you go, their standard of care, quality of care will be much less because they get much less money from the government and because it's going to be overcrowded in the emergency. Shit piles on, right? unless you are a very wealthy American. The tax cuts that come from the $800 billion coming away from Medicaid, the $300 billion coming away from to help those who don't have insurance, is going back. Those tax cuts are all going back to the richest of the rich. As nurses, as American citizens, as people in this country that rely on healthcare to keep them alive, which is every single one of us. It just is every single one of us. So if you are a human being and you live in America, I am talking to you right now. You better pick up that phone and you call the senator right now. I'm going to put this number somewhere over here. Call that number, call your senator, and you tell him sternly, respectfully, but sternly, make sure he understands what you mean when you have this conversation with him. Have this conversation with your senator. Let them know that if you vote for this bill, that is and will be the last time you are in office representing me. You better let them know that, because this bill cannot pass. This bill will destroy people's lives. This will destroy families. This is the beginning of our country crumbling, because this affects every single American citizen in this country, and I promise you that. As nurses, I can't say much outside of making this call. What you can do on your day-to-day, literally, this is the advice, this is the only thing we can actually do in our day-to-day jobs to make this problem a little bit less, which is actually very helpful. But all I can say is talk to your patients about preventative. We're going to help. It's all about preventative care right now, right? You have to help them prevent any issues moving forward. I'm talking about healthy diet. I'm talking about teaching them about daily workouts or weekly workouts. I'm talking about, the things that will prevent them to getting sick, because if this bill passes, we are either having to become the healthiest nation on the planet, or we are going to crumble, because millions will be uninsured and hundreds of thousands will die. I am sure of it. I am sorry to be bringing you this crazy news, and I'm sorry that I've been ranting the whole day, but just learning this information, just trying to help it, it's sinking in. It's just an insane amount of greed, an insane amount of selfishness from this Trump presidency to just be saving his 1% wealthiest people in this nation millions and millions of dollars, on top of the fact that they are the least to worry about any healthcare bill, including this one. Thank you. Please let me know what you think about this entire situation in the comment section below. Like, subscribe, please and please and please. Thank you. I will catch you guys later. Deuces. And don't forget, call those senators. Let them know they are not passing this bill. They are not passing this bill.